So I'm just a orthopedic surgeon, just starting to do this live. I do these live sessions just about weekly, just to talk about my experience and go over some questions about sports injuries and talk about what it is to be an orthopedic surgeon in general. I'm an orthopedic sports surgeon in Houston, Texas, and I focus on injuries of the shoulder, hip, and knee. And I do these sports injury lunch and learn type things once a week just to talk about some injuries that you might have and questions that you might have about orthopedics in general and sports medicine specifically, as that's like my specialty. And so I try to keep these about 25 minutes or so and I answer as many questions as I can get to. If I don't get to your question, just send me a DM or comment sometime along it, and I will try to get to your question at some point. And so just wait for some folks to join, and then we're going to get started. So let me just start answering some questions. So thanks for joining. Um, Quick question is, how long does it take to become a surgeon? I'll just answer that quickly. 4 years of medical school, 5 years of orthopedic surgery residency, and a year of fellowship training, and that's after college. So first question, Christian says, what is a regular ACL recovery? So ACL recovery can take about 9 months in general to recover from the ACL. It takes that amount of time because that amount of time is required for your muscles to recover, your range of motion to recover, and the ligament or the reconstructed tendon to become a ligament. So it takes about that amount of time. And you want to make sure you do all your physical therapy to make sure you have a successful chance at getting back to your sport. And CMAX says, can you have too many revision Bankharts? I've had two and sublux my shoulder again. So Bankart surgery refers to a stabilization procedure to the shoulder in which the labrum tears with a dislocation. A Bankart surgery repairs that labrum to give you the ability to have a stable shoulder. If you've had multiple dislocations that don't get better with a labrum surgery, which is usually done arthroscopically, sometimes you might need a stabilization procedure that is done open, where a surgery is made and an incision is made, and you have to sometimes move bone to stabilize the shoulder instead of doing it arthroscopically with anchors. So Trunks Navy says, do you deal with fat pad impingement? So fat pad impingement is referring to a syndrome where you have pain in the front of the knee, and sometimes there is a structure called the fat pad in front of your knee that can cause pain and has symptoms such as pain with squatting and things like that. But I do treat that condition, so hopefully you're getting treatment for it. So user some long number says, how long to recover from knee replacement? So knee replacements is a procedure I don't currently do anymore, but it can take, people would say, anywhere from 9 months, 6 to 9 months to fully recover from it. And patients get stronger and stronger as they keep on doing the physical therapy. Getting a question from JC Jan. It's about a thumb fusion. So I'm a shoulder, hip, and knee doctor, so I'm going to keep my questions and answers to those. Shoulder, hip, and knee for the most part, and sports injuries specifically. So Roman Orlando says, I had an ACL surgery 11 months ago, and my quad is still about half an inch smaller. Is it safe to play? So that's a great question. After ACL surgery and after a lot of knee surgeries, you have atrophy of the muscles around your knee, particularly the quad tendon, depending on what kind of graft that was used. For an ACL reconstruction with a quad tendon graft, which is the graft that I typically use for my ACLs, it can take a long time for that quad to regain the strength. If you still have atrophy after an ACL surgery, it is still okay to go back to playing your sport as long as you can meet some criteria that I usually have patients go through, meaning that they have good dynamic stabilization of their knee and the ability to do strong explosive motions. But you have to be careful with going back to your sport when you still have atrophy. So that could predispose you to some injuries. If I missed your question, please send me a DM. Um, so Jared says, how to prevent rotator cuff pain when serving in tennis? What workouts? So I'm not a physical therapist, so I'm not going to necessarily go over exercises to prevent injuries, unfortunately. But I can tell you with rotator cuffs or rotator cuff pain, if you continue to have issues with overhead activities such as tennis serving, and you feel like your shoulder is bothering you, I would tell you to see an orthopedic surgeon to get it checked out, because sometimes you can have some issues from anywhere from rotator cuff tendonitis, which is inflammation, or you can have an actual tear. So if you have pain that is consistent with overhead activity, you should probably get it checked out sooner than later. Um, so Matt Scott 63 says, I have a 15-year-old softball player that has a dysmorphic radial head and has limited extension of -10. That all will get therapy. So if you have, so this sounds like this is a player who has a congenital defect or a defect in their form due to how their bones were formed. And so I think there should be a limit, unfortunately, to what that patient can do with their elbow and how they can move their um, elbow because of that defect in that in the elbow. So sometimes there might be limits to what can be done with physical therapy in that situation. Thanks for the question. Um, so Tony says, what's the procedure that I do the most? I do rotator cuff surgery and ACL surgery um, most commonly in my procedures. Tiptoe tip says, which one is harder to recover or has a longer recovery, meniscus repair or ACL reconstruction? That's a great question. So ACL reconstruction can take about 9 months to recover. A meniscus repair, anywhere from 6 months to 9 months. So they might be similar, but I think the ACL reconstruction probably might win out in terms of the longer recovery. Jay Flexel says, how long does it take for a slightly dislocated kneecap to heal? So patella instability is a problem for a lot of people, and it can be treated non-operatively with physical therapy. Usually you have to stabilize the patella with physical therapy that works on strengthening the quads. And that can take about 6 to 12 weeks to really develop some good quad strength after physical therapy. So I'm going to skip around here. If I miss your question, please send me a DM. So May says, I just started walking yesterday, 4 weeks post-op patella tendon repair. Is it normal to have joint pain? It can be normal in general. I don't know your specific situation, obviously, but people who start walking after a significant patella tendon injury or any patella tendon repair or some kind of repair to a tendon around the knee can have issues with initiation of ambulation because of the tightness that happens around the knee. So it is common to have some of these pains around the knee when you start a new when you start ambulating after not really walking without bending your knee. So I'm going to skip around here. I have, so yeah, I'm trying to do your shoulder, hip, and knee questions. So sorry if I missed some of these questions. I'm trying to keep it limited to that. So Jefferson Burkhouse says, hi, what do you think the ACL injury mechanism is, and how can we prevent these injuries? So you're asking about how do you tear ACL. So ACL injuries happen because there's a pivot shift that happens in the knee. So basically it happens when you land in an awkward position many times and your knee is rotating, and also it's going into an awkward position, as in it's going inwards. And so it's really this pivoting motion that happens. And sometimes, unfortunately, it's how people land. And when they jump and they land, their knee is not in an optimal position. And so the way you prevent it is basically to work on landing mechanics. And women are known to have this difference in anatomy because of how their leg is aligned. And sometimes they are more susceptible to ACL injuries because of this alignment in their leg. But that's a great question. So Zach Spin 1 says, fastest time you have seen someone come back from an ACL to play basketball. Usually, the fastest time to recover from an ACL I've seen has been 6 months, but I don't recommend that timeline because there is good evidence that the timeline should be around 9 months because of the healing mechanism that happens inside of the ACL when that happens. So fast is not necessarily better. So Tyler Beeston says, how serious is an MPFL reconstruction surgery and how long is the recovery? So that's a great question. MPFL reconstruction is for patella instability or dislocation of the patella. I plan on putting in another video about this because I get a lot of questions about this. But MPFL reconstruction surgery, which I do relatively frequently, is very good for stabilizing the patella. And the recovery process is anywhere from 6 to 9 months, and patients go back to playing their sport pretty successfully. So I'm going to skip around a little bit here. Enzo Pereira 31 says, I've torn my ACL 3 times, a third, no surgery. What can I do to strengthen it? So multiple ACL tears obviously is a very bad injury and bad issue to deal with. And unfortunately, that's a lot of recovery time, a lot of missed time of playing. And so I'm sorry that this has happened. But if you've had multiple ACL tears and you are not going to have another surgery, so you're going to be someone who does not have an ACL. So someone without an ACL should not do pivoting sports because they might have instability in those activities. So running with pivoting, such as basketball, football, soccer, and those sports should be done with a lot of care. In terms of strengthening your knee, working on quad strength, hamstring strength is probably the best thing to prevent any other further problems with that. Kendo Louis says, how long after plica and Hoffa pad debridement can I walk? So that refers to basically shaving the front part of the knee, some soft tissue structures that are causing pain. And it's really a minimal procedure that we do arthroscopically. And in any arthroscopic procedure that's minimal in general, you can ambulate pretty much right away. That's what I tell my patients when they have a similar type of procedure. So ambulation should not be limited in that situation. Glad Society wants me to create a case corner for sports medicine. Sure, I'll do that. I'd be happy to do that. Thanks for the suggestion. So I'm going to skip around here. So Sarah Goldie 03 says, do you like using allograft or the person's own tendon? For ACL specifically, I use autograft, which is their own tendon, 95% of the time, unless I have a very good reason not to. I really think that autograft is the way to go for most patients. Depends on their activity level and their age. As you get older, I think the benefits of allograft and autograft are more even, but for younger, more active, competitive athletes, I'm almost never use an allograft for their ACL. So that's my typical algorithm for that. So I'm going to skip around here. Posterior tibia talus. So thanks for your questions. If I missed your question, just send me a DM. Sorry. I4 bulging. So try to send me a question about shoulder, hip, and knee. If you don't, I can try to answer the other questions, but I'm a shoulder, hip, and knee doctor, not a spine doctor, not a hand doctor, not a ankle doctor. We're very specialized in orthopedics. So Octroy says, my inner knee keeps opening and causes my bone to shift. What is happening? It's hard for me to diagnose you. First of all, I don't diagnose on this forum here, and it's hard for me to kind of get an idea of what's happening. If you have pain in the inner part of your knee, most likely, if you're older, sometimes that can be a sign of arthritis. And if you have shifting or any kind of cracking in your bone, sometimes that might be a sign of wear and tear in the knee and should be evaluated at the minimum with an X-ray by an orthopedic surgeon. So Dana says, are slap tears normal if you aren't an athlete? You can have a slap tear, which is a superior labrum anterior posterior tear. That's what the SLAP stands for, SLAP. It's in your shoulder, and that can happen from overhead activities, in playing sports, or just life in general, from doing push-ups or doing any kind of activity that might cause your shoulder to be in an abnormal position, like pushing something. So you don't have to be an athlete to have a SLAP tear. Seth Garcia 99 says, "Hey doc, in 2019, I chipped a small piece of cartilage in my knee. Doctor told me it would heal." So I would say, in general, cartilage does not heal. It does not have the ability to heal itself inherently. And so what we do, or what I do in a lot of cartilage restoration or cartilage saving procedures, is to regrow the cartilage or transplant the cartilage, because of that very reason, that cartilage does not heal on itself by itself. So Brian Volske says, shoulder impingement therapy treatment, shoulder impingement therapy. So I'm not a physical therapist, but shoulder impingement is basically pain in your shoulder from either tendonitis in your rotator cuff or some bony abnormalities in your shoulder that cause your shoulder tendons to be pinched when you move it around. So typically you do therapy to strengthen the tendon and to do movements that help to alleviate the pain. But I don't know the exercises because I'm not a physical therapist, and I send patients to physical therapists for that very reason. So Alex says patellochondral flap grade 3. Give me a lot. Okay. Patellochondral flap grade 3 with bone bruise and debridement done. Still hurts with pressure. So what this question is dealing with is a patella injury, a patella cartilage injury, and grade 3 is of grade 3 out of 4. So that's kind of a higher grade injury to the patella. And the bone bruise tells me that there is some involvement of the bone marrow, or the bone that supports the cartilage, which tells me that that's a cartilage injury that has been chronic in nature, and that bone has been seeing a lot of stress. And so in that situation, the way I treat a cartilage lesion in the patella is to actually create the cartilage by doing a procedure that regrows the cartilage, and I put the cartilage back on the patella to prevent any further problems with the bone and the cartilage. Or I actually transplant the cartilage and put it back on the area that has the cartilage that is missing. So that's a pretty significant cartilage injury for the most part in general. So Jam Jen says, wrestling, tore ACL, meniscus, LCL, and lateral tibial plateau, pain 11 years later. Sorry to hear about your injury there. Sounds like you had a significant injury to your knee wrestling. If you still have pain after that big injury, I would definitely see an orthopedic surgeon, get some x-rays, and see if there's something happening now that can explain the pain, which I would probably guarantee that there is, unfortunately. So that should get checked out with an x-ray. That is what I would tell someone in that situation. So O says, I tore my lateral meniscus, got a full repair. I'm committed to play D1 lacrosse. I'm in PT. When can I run? So I usually tell patients after a meniscus repair, it kind of depends on how the recovery process is going. They typically start running around the 3.5-month mark or so. And that's my own protocol, but you should follow your own surgery, your own surgeon's advice. Good luck with your surgeries, Dana. CJ says, I have an MRI on Monday for a possible torn meniscus. Any tips? Stay still. So, but in all seriousness, I don't know if your question is about the MRI, but MRI is very critical for diagnosing these injuries, and patients have some difficulty sometimes staying still in these MRIs because it's very uncomfortable, it's very claustrophobic, but they're key to getting a good diagnosis. So Ross the Salad says, typical recovery time for a hip ligament tear caused by running. So I would say the question, I don't know if your question is about hip labrum surgery. So if you have surgery after a hip labrum tear from running, it could take about 4 to 6 months to return to running after that surgery. So, but you will go back to running. It usually is very successful for getting patients back to playing their sport. Um, So Emma Grace Kilgo says, "Hi, I had a TTO and MPFL repair surgery for a dislocated knee. Would BFR help recovery time?" So that's a great question. So this question is referring to a stabilization procedure for a patella dislocation. TTO is a tibial tubercle osteotomy, and MPFL is a medial patellofemoral ligament. So that ligament stabilizes the knee. Excuse me, that ligament stabilizes the patella, and the TTO part of that procedure realigns the leg or the tibia to prevent a lot of the dislocation forces. And that's a procedure combo that I do typically for patella tendon, patella dislocations. BFR refers to blood flow restriction therapy, and it has been shown to be a very good physical therapy treatment option to help patients do a um, a exercise without heavy weight. So what it is, it's basically putting a tourniquet around your leg, and it feels like a tourniquet around your leg. It can be somewhat discomfort. It can be somewhat uncomfortable when you have it on your leg, and you are able to do heavier weight, or excuse me, lighter weight, but it feels heavier because it feels like it fills up your leg with basically lactic acid. So it makes the workout harder with lighter weight, and it's good in the recovery process for lower extremity sports injuries such as ACLs, ACL reconstruction, and MPFL reconstruction. Um, so I'm going to skip around to some questions here. So Still Focus says, Achilles tendonitis, what do you know about it, Doc? I have a friend that plays for the 49ers. Great, good. So Achilles tendonitis can be painful and can also lead to Achilles tendon rupture. So I usually take it pretty seriously if someone shows up to my office with Achilles tendonitis, and I recommend physical therapy. And the physical therapy that they do is pretty much a lot of eccentric strengthening, which is lowering or lengthening your Achilles while you strengthen it. A typical Achilles eccentric stretching move is to sort of slowly drop your heels off of the stairs and do a couple calf raises, and that basically is a nice eccentric strengthening exercise for that. Um, um, so Easton Moore says, can I keep getting on bucking bulls with a broken rib? I broke it 3 days ago, but I want to ride. So one, I can't give you medical advice specifically, but I can say that broken ribs are not inherently dangerous. They are definitely very painful. So a broken rib, as long as there are no lung issues such as breathing issues or anything like that, it hurts to breathe, but as long as you do not have any problems that indicate you have a pierced lung, uh, usually we allow athletes to participate as their pain allows. But that really it can be very dangerous if you play a contact sport where you can have a collision into the same broken rib that might actually cause lung issues. So, in general, I would say it is a dangerous thing to do a collision sport or a contact sport if you have a broken rib, but it is not a contraindication specifically. Um, so CJ says, do all meniscus tears require surgery? My initial diagnosis is an acute lateral tear. Um, So meniscus surgeries do not all require surgery. Some meniscus surgeries may require surgery if they're symptomatic, meaning if you have catching, locking, swelling of the knee that really prohibits you from doing your sport, that can be an indication that you need surgery. Sometimes people try physical therapy to see if they can compensate for the tear, and that can be helpful sometimes. But many times, if you're an athlete and have an acute tear that causes all those above symptoms, I recommend a surgery to fix that tear. So, So Sandeep Singh says 2 days post ACL patellar graft reconstruction. Any tips for the first 2 weeks? I tell patients who just have ACL surgery, the thing that they should really work on is range of motion. And so you want to get full range of motion of the knee. That means you want to get your knee as straight as possible, and you want to get your knee bending as much as possible, as soon as possible, unless your surgeon tells you that there's some other specific issue you have to worry about. But range of motion is the most important thing to work on after an ACL, in my opinion, for my patients. Um, So I'm gonna skip around here for some questions. So Arch Troy says, I got inner knee pain, and when a pain soccer, it swells up and I can hardly work. So I guess the question is, this person is saying they have inner knee pain, and we play soccer, it swells up and can hardly walk. So I would say to that, I can't diagnose you obviously, but anytime you have pain in your knee and it swells up, it needs to be seen by an orthopedic surgeon. Full stop. Anytime your knee swells up, it is not normal, and there usually is an issue, especially if you're a young, active, healthy athlete. There could be an issue such as a meniscus tear or cartilage problem, because the knee does not swell up without a actual problem. So that should be evaluated with a X-ray at least, and an evaluation by an orthopedic surgeon. So Holden Kutsis says, what can I expect from an osteochondral allograft shoulder, 40% cartilage loss? I guess I'm not sure I know what surgery you're talking about. Possibly having some cartilage reconstruction or cartilage transplant to your shoulder. If that is the case, so typically the nice thing about shoulders is that you don't weight bear on your shoulders, meaning you don't walk on your hands for the most part, unlike your knees. So the shoulder does not see as much stress as the knee or the hip. So many times if you have cartilage problems of the shoulder that are treated appropriately, you can do well from that, because of the very fact that we are not four-legged animals anymore. If you have a cartilage problem that is fixed, you should have some good relief from that, longer than if you had a knee problem, because you walk on your knees. So Vilala says, why am I having knee pain 6 months post ACL surgery? Obviously, I can't answer that question as I'm not your surgeon, but for people who have pain in their knee after an ACL surgery, a lot of times what they are experiencing is pain in the front of the knee around their kneecap. And that's because their quadriceps muscles are not strong enough. And so the kneecap is not gliding properly and is causing pain in the front of the knee when they squat and they go up and down stairs. So the treatment for that typically is physical therapy to work on strengthening the kneecap. So Danielle Odino 169 says, I currently am dealing with a torn ACL. Would you recommend patella or quad graft? That's a great question. So that's a surgeon specific question, because I prefer quad tendon graft. That's what I do 95% of the time now. I just think it's a great graft because there's less trauma to the knee when you take the tendon. With a patella graft, you actually have to cut bone from the patella and cut bone from the tibia. And I just think that's a lot of trauma to the knee. And the complications from the patella tendon graft is that you might have some anterior knee pain. And the anterior knee pain rate can be upwards of 20 to 30% sometimes for some people. And it can be somewhat debilitating for some people. So ST Spence says, are you talking about actual sports injuries like Josh Allen's hand, or just injuries in general? So I'm talking about injuries in general. I often tell people I don't have time to follow the news and pay attention to athletes that don't pay me for their care. So I don't necessarily comment on sports injuries that you see on Sports Center or anything like that, because I have enough on my plate taking care of my own patients, and I take time, and my energy is usually spent on that. If Josh Allen wants to pay me to talk about his injury, I'll be happy to talk about that. And any other athlete, if they want to pay me, I'll talk about it. But I take care of my patients and talk about and spend time thinking about them and not what I see on TV. Sports is taking care of people. Yes, I understand. Oh, sports is greater than taking care of you. Okay. Unknown legends. I got an Achilles donor graft for LCL. Is that good? Um, I'm not sure. So LCL reconstruction or any kind of ligament reconstruction, you can have a donor graft, and that can be a good outcome as long as it's done appropriately. So I don't have any issue with having a allograft for your LCL if that's what happened. Um, so Jimmy Longneck says, "Can you explain to me what a List Frank fracture is? I had surgery for it and then had a non-union." So List Frank is the name of the ligament. It's the name of a French doctor, but it is a ligament in the foot. Basically, it's the strongest ligament in the foot, and it helps to stabilize the foot. And sometimes you can injure it with a lot of loading injuries to the foot, and sometimes it causes a lot of problems with running if it's not appropriately addressed. Um, Carrie Olson is asking about ankle prone to sprains. I wear a brace. What else can I do? Physical therapy with stretching and strengthening of the ligaments around your ankle. Again, I'm not a physical therapist. I don't know specific ankle exercises I could tell you to do, but I would have you see a physical therapist for that. But if you have frequent sprains and issues, I would probably have you see a foot and ankle surgeon who specializes in that issue specifically. Dylan Carano says 12 weeks post-op ACL, PCL, meniscus repair, only around 115 degrees. Flexion, should I be concerned? So that's a great question. So it sounds like you had a multi-ligament knee injury and you are going through physical therapy, which is a tough process after a multi-ligament knee injury. So 115 degrees of flexion is not the ideal flexion angle that I would want at 12 weeks after surgery. Just to be perfectly honest, in my opinion, I usually want my patients at least 120. You're close to it, so I think you might be able to get there. As long as you're at 120, there is a good, I think in general, there is a good reason to believe that you will do well and keep on getting your knee flexion. But 115 is close to 120, so it might be good enough. So Sadie says, how long should I wait to return to lifting after mildly dislocating my kneecap? Depends on if you've done physical therapy. If you've done appropriate physical therapy and feel no pain and have been doing some exercises without significant weights, I think it is fine to go back to a lifting activity regimen. So Christian says, what level of math do I need to complete to get into the medical field? You need to complete calculus at least to get into medical school. Last I checked, but that was a long time ago for me. So I have about 5 minutes left here. Thanks for joining. If I miss your question, please send me a DM. So Natalie Jones says, what are your thoughts around augmentation? Have you ever heard of BioBrace? Thank you for that question. So BioBrace has to deal with the ACL or some ligaments in general. When you're able to augment the ligament or the reconstruction with a biologic that helps to decrease the chance of re-tear. So BioBrace is a company that does this. Yes, I've heard of BioBrace. I have not used it. I think BioBrace people are looking to talk to me about using it for my ACLs, actually. So I don't know if you were sent by BioBrace, but they are definitely talking to me about that. Nayati Shah says, I was diagnosed with facet joint inflammation in the lumbar section. Should I be concerned? So facet joint inflammation just refers to pain or irritation of the joints in your spine. It's not necessarily a dangerous condition. It's a painful condition. And that's one of the causes of back pain in general. So Joe says, is it common for a labrum to tear with an impact injury like falling on your shoulder? Yes, that can happen. Likely that mechanism has led to a dislocation or a subluxation of the shoulder, because the labrum is the stabilizing structure of the shoulder. So in order to have a labrum injury from that kind of injury, usually you probably have had a subluxation or a minor dislocation of the shoulder. Ryan, what are your thoughts on nurses? I think nurses are great. We can't do our job without nurses, so they are indispensable. Uh, so Grayson says, I've torn my ACL twice as well as my MCL, PCL, meniscus. Should I have went back to football? Uh, so, I think lots of athletes play football after ACLs and they continue to go back to playing their sport. It depends on kind of what you want to do in life. If that's what you want to do in life, I fully support that. And that's why I do my job. That's why I do these surgeries, is to get patients back to doing whatever they love, whether that's playing football, going to the park with their kids. So if that's what you like to do, I don't think you should necessarily beat yourself up if you've had multiple injuries. I'm going to go a couple more questions before I have to go. Dislocated kneecap twice. So Evan just says, dislocated kneecap twice in 5 months. Do you recommend surgery? Last dislocation 3 months ago. So that's a great question. So after you dislocate your patella, you probably have about a 30% chance of dislocation afterwards. People who've had multiple dislocations usually have the decision to make whether or not to have surgery. And that decision basically is how detrimental to their lifestyle is the dislocations. If they're significantly painful and really cause a problem playing your sport or being active in general, that's when I usually recommend patients to have surgery. Yes, I operate at Baylor. No, I don't operate at Baylor main campus. I operate at McNair in Houston. Um, so Jose Castillo, I tore my meniscus. Do I need surgery? It just depends on your symptoms. If you have locking, catching, swelling, and can't play any sports or activities that you want, I would usually recommend surgery. So Nolan Valdivia says, I've had pain in the area of my teres minor and major. Pain hurts when I do pull downs at the gym. You have a very good grasp of anatomy, is what I would say, if you know where the teres minor and major are. So it's the back of your shoulder. If you have pain in the back of your shoulder, I'd probably have you see an orthopedic surgeon. You could have a strain of the tendon, or it could be a nerve issue as well. So I am going to answer one more question. So Rena has the last question here. Thanks everyone for joining. Again, if I missed your question, please send me a DM. So Rena says, I had patella reconstruction surgery for my knee. I can't get muscle back in my leg now. What do I do? So any knee surgery in general can cause atrophy of the knee and atrophy of the muscles around the knee. It is very difficult sometimes for patients to get back their muscle strength. Sometimes they can't get the muscle strength back, and that's unfortunately one of the complications for some of these surgeries. If you feel like you have not completely done your physical therapy and can have it in you to do more strength training, that has been shown to reverse if you do enough strength training. So sorry, I have to leave you guys here. I have to get going, but I appreciate you joining me for this session. And again, if I miss your question, please send me a DM and follow me along, and I'll try to answer questions in general, and I'll have more informative content on my site and on my profile. Thanks a lot. Take care. Bye.